Welcome to Portal to Health, using the patient portal to support chronic conditions microlearning series brought to you by the California Telehealth Resource Center. This is our final session, Microlearning 7, Increasing Portal Engagement. Before we begin, we do want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative support services with providers and patients located across all 58 California counties and beyond. As part of a collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017, and together they reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations and serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. HCCNs are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology. This is very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports over 100 participating health centers using a variety of electronic health records and serving over 4 million patients. It is funded by HRSA. And we welcome you to check out the OCHIN HCCN webpage to learn more.
All right, and I am Angeli Brown, Learning Content Designer, and I'm joined by Lourdes or Lulu Gonzalez, fellow Learning Content Designer and wonderful teammate. Before we jump in, here is a list of all the microlearnings in this series. Each session is designed to deliver quick learnings on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. So with that, welcome to Microlearning 7, Increasing Portal Engagement.
And speaking of patient engagement, let's begin by looking at why patient engagement is important at large. We can define engagement as the degree to which a patient is actively involved in their care. This could include utilization, shared decision-making, communication, and collaboration. Patient engagement is a priority because patients are critical influencers in their own health outcomes. Studies show engaged patients tend to have better health outcomes, rely on the emergency department less often, have improved health literacy, experience higher satisfaction in their own care, and contribute to organizational goals like care efficiency, effectiveness, and quality. Relatedly, patient engagement drives other strategies like patient-centered care and patient empowerment. So where does the patient portal fit in? Studies show that portal users tend to be more engaged in their care than non-users. On the surface, this makes sense. Patients have come to expect a vast array of their information to be accessible online, from banking and healthcare to library accounts and entertainment. With 24/7 access to their health information, the portal can also fit into people's lives at their convenience. It serves as another connection point to their care team, and the portal can aid self-management of certain conditions. There is an important caveat to all of these facilitators, which is that this works for those with access to technology and conditions needed to use the portal. For more on this topic, see microlearning number 4, Portal Facilitators and Barriers.
So for patients that can and want to use the portal, this platform can allow your organization to meet them where they are while delivering whole person care. So beyond supporting engagement, studies find that the patient portal is generally correlated to improved patient retention, higher rates of up-to-date preventive care, and better health outcomes. And then studies similarly find improved adherence with medical advice and medication instructions among patients who use the patient portal, particularly for chronic conditions such as asthma, congestive heart failure, and type 2 diabetes. So no matter the patient promise of the patient portal, we do recognize that it has its own barriers and challenges for patients. So we want to understand what patients' barriers to adoption are. The ONC, now called the Assistant Secretary for Technology Policy and the National Coordinator for Health Information Technology, or ASTP/ONC, has cited four main reasons that patients do not sign up for the portal, which is echoed across other literature. So these are that the patient doesn't remember discussing the portal with their provider. That piece of communication really is critical. That they simply are not interested or motivated to use the portal, or that they have not been given the information, and that they are not confident in the portal's benefits, and that they need extra help with technology, such as computers or navigating the online portal.
So we're just going to take a quick moment to reiterate an important point that we shared in microlearning number 4. And we want you to keep in mind that developers generally do not design these tools like the patient portal to be culturally responsive. Instead, the focus of developers is to create tools that securely and accurately support healthcare delivery. So often it's the human to human support that helps patients adopt digital tools across different cultures. And so think of the patient portal and patient portal enrollment as the starting point rather than the end goal to truly facilitate engagement with this digital tool. So to quickly touch on some well-known portal engagement strategies, we can include tactics for enrollment and adoption. Of course, knowing your audience, in this case your patients, is essential. Understanding their top needs like language, tech, and connectivity status, literacy levels, and general interests will inform your efforts. To that end, try to provide resources where possible to fill gaps for those with barriers. Socialize that your portal is the default communication pathway for non-urgent medical messages, reminders, and results. Appointing staff champions can keep that momentum going. Always include stakeholders in workflow, communication, and improvement efforts. And remember to add policy, processes, and protocols that support your portal goals. And offer the portal to every patient. Align features with benefits when discussing the portal, and when possible, help the patient sign up in the office before they leave. Provide training for staff and patients on portal use. Track those adoption rates, use, and related outcomes. And open feedback loops so that patients and staff can share their experiences.
Okay. And so in addition to those fantastic tried and true strategies, we wanted to provide some others that we have learned from our OCHIN members who are doing this work day to day. So this includes developing patient-facing materials that are customized to your health center and your patient population's needs. This could include step-by-step instructions that are simple, use large images, and are tailored to devices and translated into your top languages. Also, if you notice that certain common issues, such as trying to produce an outline or printed FAQ to help patients troubleshoot on their own before reaching out to the clinic. Common issues that we've heard of are resetting passwords, sending messages to the correct destination, requesting appointments, and using telehealth. So these FAQs can be located on your clinic website to help patients access them wherever they are. So speaking of websites, and we mentioned this earlier as well, but this small but effective tactic really does help direct patients to the portal. So make sure that it's easily accessible in the upper right corner. This is where users often look for calls to action or places to click. Adding key benefits to this area really can encourage use, such as available 24/7, and then definitely emphasize the self-service functionalities that help patients while freeing up staff time.
Yeah, and consider whether other departments or services can better leverage the portal to support chronic condition management. Because of its flexibility, communication features, and patient education capacity, the portal can greatly benefit services for mental health, behavioral health, pediatric care, prenatal care, dental care, and nutrition. And in addition, the portal may be able to be used for group or peer support visits. And remember to track your progress. We'd like to point out a few ways to do that. We can do this by using some nifty EHR reporting features to help us monitor things like enrollment by provider or care team and also by location. We can also track our activity by condition or demographics. And importantly, we can see how we're doing by collecting feedback from patients and staff to see where there's room to make little improvements.
Okay, so finally, here are a few suggestions on sustaining your portal efforts. Gather patient feedback on how patients are feeling about the portal. As we saw, patient feedback can really help where the tool needs a little bit of personalized support or human help. Provide ongoing or periodic portal training so that staff are up to date and refreshed on the information that they share with patients. Explore community-based partnerships that can help patients build their technical capacity. There may be partners in your medical neighborhood that offer tech support, materials, or even broadband to residents. Some partners may include an immigrant resource center, libraries, or digital literacy training programs. Additionally, you can advocate for broadband infrastructure in your community to aid access to the portal and many other essential online needs. And we are at the end of Microlearning 7 and the end of our Microlearning series. So for this session, we wanted to make sure that you are focused on enrollment, but not forgetting about use. Helping patients to enroll in the portal is truly only the first step. It's important that they also use it well. Remember to use data for continuous improvement, monitor adoption rates, activity, patient feedback, and other trends to refine strategies and improve patient experiences. And promote a responsive design that every patient can access. Ensure materials and tools are accessible, multilingual, and culturally relevant to increase engagement.
Yes, and thank you to HRSA for supporting this content. And for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, or on-demand resources, and so much more. You can also reach out to us directly at caltrc@ochin.org. And don't forget to sign up for CTRC's newsletter.
We're very excited about that one.
Yes.
Thank you so much for joining us, and please reach out with any questions.